let's talk about what can we do after radiotherapy when our muscles of chewing or mastication are not working well. After head and neck cancer treatment, our patients may experience a significant amount of discomfort or pain in the oral cavity. These patients may not be eating yet. They may have a feeding tube in place in their abdomen or belly, and that's the way that they receive nutrition. One of the exercises that can be implemented is by chewing on a soft chewy tube or a hard chewy tube to exercise the muscles of mastication. Most commonly, the masseter and the pterygoid muscles. There's a medial and lateral pterygoid that work together to open and close and shift the jaw from left to right and help us chew. This is a complex process involving cranial nerves, the muscles of the tongue as well. Now, if we are a patient who is really working to improve our intervention and how we're going to get back to chewing, we may place a chewy tube recommended by our therapist inside the mouth and we may bite down on that chewy tube. This particular chewy tube has different sides and textures. Those textures, for our purposes, are not necessarily really matter. They just give you some different input to the cranial nerves when you place it in. Now, depending on where the cancer was, your therapist may guide you to do a certain number of exercises on the left side or the right side or both. We encourage you to find a therapist in your area who is specialized in working with Trismus intervention to help guide the next steps for you returning to eating and drinking and getting your mouth open.